We would like to acknowledge the Yuggera people and the Turrbal people as the traditional custodians of Meanjin, the lands on which we record this podcast today. We pay our respects to elders past, present and emerging. Always was, always will be, Aboriginal land. Welcome to another episode of For the Health of It podcast, a podcast made for healthcare professionals by a nurse on the inside. So my name is Jess Tully and I'm the Brand Ambassador for Healthcare Australia, a registered nurse myself, but also your podcast host today. So today's episode is getting deep into our minds. So this episode is something I've been wanting to do for a really long time, and we're going to dive into how we think, how we process emotions while getting out of your comfort zone. So working as a casual worker, agency, or a locum worker, we're constantly being thrown out of our comfort zones in new facilities, new hospitals, new environments. And we want to dive into how do we deal with this better? So I have the incredible, the amazing Sam with us today, who is a trained psychologist and knows everything about the brain that is going to help us manage this so much better. So welcome to the podcast, Sam.
Thank you, Jess, and thank you for such a lovely introduction.
I love hyping it up because it's going to be such an amazing episode and so many people are going to get so much value out of it. So I really appreciate your time today. Now, I would love to dive in a little bit about you first and your role in psychology, a little bit about you personally. Go on, tell us your story.
Right. So I am a registered psychologist and have been for 23 years. Showing my age. And I've worked in hospital settings, in crisis teams, and more recently in private practice. I was also the clinical mental health lead for the hotel quarantine project during the COVID pandemic, where I managed over quite a number of staff, psychologists and mental health nurses across 20 hotels. And I'm also currently the lead psychologist for a service that Healthcare Australia is running, providing psychological services for older persons in rural aged care facilities in New South Wales. So that's what I'm doing at the moment. And along that, I continue to do my private practice.
Wow, you have a lot of experience behind you. 23 years. I mean, you look amazing, by the way.
Thank you.
That is incredible. And, you know, it's something that we're always going to need. Like mental health is such an important part of our lives when we go through waves of emotions constantly. How was going through all the COVID stuff as well? Because that would have been quite a lot for you to handle because that was a huge spike.
It was a huge spike. Obviously, you know, if you had social anxiety before COVID, well, let me tell you, COVID validated that social anxiety. A lot of people were isolated, removed from loved ones. Those in hotel quarantine forced into isolation for 2 weeks, particularly those with mental health conditions. It was quite possibly the most challenging time of my life, of my entire career, working in mental health. And we're still feeling the repercussions of it today, as you could probably see in your own, with your own team, your own family, your own friends, people around you. The lingering impacts of, the pandemic still remain.
Absolutely. Well, you're going to be a busy woman for a very long time by the sounds of it. So thank you again for coming on today. I get asked a lot because I've been doing like agency style nursing for about 5-6 years now. And a lot of people, they kind of worry about a few factors. They're always like, oh, I'm worried about income changes because it's casual work. But then the second thing that really comes to their mind is they're so worried because they're so afraid of going out of their comfort zone and going into these new environments constantly. They're like, oh my God, what do you mean you have to go to like different facilities all the time as like a casual worker? And like now looking back on it, it sounds really scary, but now that I've done it for so long, it's not as scary for me. But I do remember those waves of emotions and I still go through a feeling of those emotions now. What kind of tips would you give for people that wanting to go down this path of doing either a locum style like travel nursing or joining the agency world and going to these new facilities, but they're really, really, really nervous? What tips would you give for these individuals?
Well, firstly, it's completely natural and normal to be nervous when you enter when you're entering new social settings or new workplace settings or just entering a new environment altogether. We are innately, we are creatures of habit, so we tend to resist change and we tend to kind of keep status quo. However, it is important, obviously part of living is putting ourselves in very uncomfortable situations. So for agency nurses or locums in particular who have the opportunity, and I call it an opportunity because it is an opportunity to grow, to learn and to develop, to go into different social settings, it's almost like free social skills training. It's almost like, free exposure therapy, because we're not really free, you're actually being paid to put yourself in these situations. So firstly, I would say, validate, yes, I am feeling a bit nervous. This is a new situation. This is going to, make me feel out of my comfort zone. But remember, when we're feeling nervous and we have anxiety, our blinkers come on, right? We are more focused, we're more task-oriented. So it's vital we have some level of anxiety to allow those blinkers to come on, to silence whatever is going on the peripheral, and allow us to be more task-oriented, goal-oriented, and focused and attentive. So medium to high anxiety is going to result in optimum performance, not just work performance, in just performance in general, even in social settings. So accept the anxiety, use it, manage it through breathing, validating to yourself, hey, this is a new scenario. I'm going to come across different personalities. I don't know who I'm going to be with. And that uncertainty is the opportunity for you to push through it, change your mindset to a mindset that's like, this is an opportunity. What challenges am I going to be confronted with? What have I done in the past? I'll overcome it. The other thing, Jess, is a lot of people kind of think about the worst case scenario. What's the cost of me going into a new setting and the people there not liking me or questioning my skills and my abilities? Or a lot of people have what we call imposter syndrome. They walk in, they think, well, I'm not really good at what I do. But you are. You've got the skill set. HCA is not going to put you there if they didn't think you were capable of performing. So you've got to really kind of silence the negative thoughts, get in more focus on what you can do. And the challenges that come your way, you take them one by one.
I love when you said to accept the anxiety. Like that was a really good point, because it's like we're all going to feel anxiety at some point of our lives, and we all kind of put it as a negative thing, like it's a bad thing and you shouldn't get anxious and you shouldn't have anxiety. But when you were talking just then, I was like, oh, so having anxiety in certain situations is actually going to be good for our performance, and we've got to just accept it, and it's actually kind of a positive. So when you said that, I was kind of like, oh yeah, okay, it is okay to be to be nervous. It is okay, and doesn't mean I'm going to do a bad job. It just it's a normal emotion, and we just have to process it and be like, okay, this is normal. Just breathe.
Yeah.
And carry on.
And carry on. And also just remain focused on the task at hand, because your thoughts will try to get you that way or take you that way. Or if the anxiety gets really high, it can kind of like the blinkers close off and you get, what we call like mind blank, where, you can't push through it. In those instances, you've got to stop whatever it is that you're doing and use grounding techniques just to calm yourself down, open those blinkers up, and then try to focus on the task that you need to do. Whether it is just going and asking for help or telling somebody that you're checking in for a shift, what would you like me to start with?
Yeah, that's so great. I know that from personally doing it for years now, I've always explained this to people, and I've said, the professional growth of doing agency, I feel like there's a really huge professional growth aspect to it, because you are learning to be adaptable, you're learning to be flexible, you're being put in new environments and learning how to deal with the multidisciplinary team of like different areas. But then also I always say, I'm like, but the personal growth that you get with it as well is really incredible. And they're like, what do you mean? And I was like, professionally and personally, you have these incredible growth periods, because you kind of leave this facility being like, oh my God, I did that. I just went to a new facility and I did my shift, and I, met some really nice people and some new colleagues and new acquaintances. And I've earned some really amazing money, which I'm really proud of as well. And so I kind of leave these shifts being really proud of myself, because I've really put myself out there, but I'm getting rewarded with some incredible money, an incredible lifestyle of being able to work, when I want to work, and creating that lifestyle that I want. So I'm always like, yeah, go Jess.
Yeah. And also the social skills. Wow. The social skills. It doesn't matter where you sit on that scale of social anxiety, but the social skills, that's a lifetime. That's a skill set that you can use for the rest of your life. As I said, it's almost like social skills training that you're being paid for, exposing yourself to uncomfortable situations. So yeah, you ought to, and anyone else that puts themselves in this constant changing environments and with different people, there is only growth and resilience comes from that.
Yeah, absolutely. And I'm so used to it now when I go into facility, like I go in and I'll meet the nurse manager's office and I'll sign in. I'll be like, good morning, my name's Jess. Like, I've never worked here before. So I let them know straight away that I've never worked at this facility, introduce myself. They'll be like, you're in level B2 today. And I'll be like, oh, perfect. Whereabouts is that located? And what type of ward is that? What specialty? So I like get prepared mentally in my head. I'm like, am I going oncology? Am I doing orthopedics? Like, what am I doing? Because you get nervous when you don't even know what ward you're going to. So I kind of gotten into that routine. Instead of just leaving and trying to find my way, I actually go, hey, how do I get there? Can you tell me how to get there? Which lift do I take? Which way do I turn? And then you kind of do that and you're like, done another step now. I'm getting closer to the shift. I'm getting closer. And I get into those like habits now. And then when I get to the ward, I make sure to tell them if I've never, ever been there, because they may just presume that I've been there a few times. They don't know who I am. They've never met me in their whole life. It might be their very first day. I don't even know.
Well, yeah, maybe the very first day. Yeah. The fact of the matter is that, you know, you start instantly the minute you walk in with that positive mindset, don't you? You've got that mind, although you're not feeling it, and then there's a bit of nerves, but you've got that mindset. You're like, today, this is who I am. What ward do I go to? And then, you know, it's a step-by-step process. They direct you. Then all of a sudden, know what ward you're at. It really is not about knowing everything. If we knew everything that was expected of us, well, life's not worth living, let's be honest. You know, it's important that you kind of know you're there for your shift, and as the day progresses, you'll learn more and more what they expect of you. But always, obviously, having a positive mindset. The mindset really shifts it all for the person that comes in. If you come in with a bag of nerves, you're less likely to speak openly. You're probably going to be reserved. You're probably going to be a little bit withdrawn. People don't do well with that. I mean, you're going to get some compassionate people who are going to give you the time and reassure you. But if you're in a busy ward, Jess, you know what it's like. It's like, on with the job. Let's get going.
Yeah. I always make sure to let people know my name as well when I meet them, like an interaction. I'm just like, hey, my name's Jess. I'm working today with you, because they don't know who I am. They know all their buddies on the ward, but they don't know who I am. So if I just like remind them my name, and I wear a very clear name badge, that way, if they're like trying to find me and they're just like, agency nurse, where are you? Like they're not going to say that out loud. And I can't feel, you know, I'm like, I can't feel like, oh, why do they not know my name? They mustn't like me, because they don't know who I am, and I am casual at the end of the day. So I make sure to like wear a big name badge that says my name, Jess. I introduce myself to everybody to remind them, and then carry on with the shift, because it can get extremely busy and you just got to get on with it. But sometimes I'll just say to another nurse, I'll just go, sister, help me. I don't know your name. I'm so sorry.
Oh, I love it. You know, you use humor. And yes. I think humor goes a long way. You know, if you can understand that they forget your name and they're under pressure and they might say things, hey, agency nurse, if you can really see where they're coming from, you're probably less likely to personalize it and say, I get it, I'm coming my way. Humor goes a long way.
I just call everyone sister. It's just like so much easier. I'm like, hey, sister, or hey, sis, where's this?
Right, that's so welcoming.
It definitely helps. So what other strategies would you give? So I know what I personally do is like I always arrive. So if it's a brand new facility, I'll always check the app and look at the address on the app, because that's super handy. I don't just write the hospital into my Google map. I actually write the address down, because I've actually been caught out on that before. For example, in WA, there was a couple of St. John of God hospitals, and some of the suburbs sound familiar. And so what I did is I actually wrote in the wrong one and was already 3/4 on the way there. But I leave so early because I get so nervous when it's a new facility. And I had this feeling, and I pulled to the side of the road, and then I went on the app and I put in the actual address, and it was half an hour away. So I learned from that. And because I had left really, really early to ensure that nothing was going to go wrong, I actually got to the shift like 3 minutes. Like I got there, signed on, and was on the ward exactly at 7 a.m. And I was like, oh my God. But the anxiety of like being late to a shift is awful. Just in everyday life, it's a horrible feeling, like when you're late, like that horrible feeling. But if you don't know where you're going, you don't know where to park, you don't know the facility, go way earlier. I arrived like 20 to 30 minutes earlier before my shift, because you could be going the wrong way. Like I did, put the right address in, and then it just calms the nerves. What other tips would you have on what to do to calm those nerves, or to get yourself prepared, or maybe exercises to do to calm yourself?
Yeah, so obviously, you know, at the beginning of a shift, you know, you've given some great tools, put the address in, know where you're going, get there a little bit earlier, even if it's to suss out the environment, grab yourself a coffee, and walk around even if you're a couple of minutes early. So being prepared is really important. The other thing is, once you get to the ward, introducing yourself and making an initial contact with somebody that you've got a good relationship with, so you can fall back to them. Obviously, once you get onto your ward, if there's going to be a lot of sisters, as you call them, find one that you really connect with. There'll always be one, even if it's just a mild connection, and make them your go-to person to have questions that you want to ask them. So know who's approachable, know who may not be approachable. If you find your anxiety is really, really, really high, it's really important that you engage in some self-awareness tactics. The self-awareness, like, right, slow it down. Think about the thought that's going through your mind. What's the thought that's going through my mind? If we have an anxious thought or a negative thought, there's going to be a feeling attached to it. And that feeling could be anxiety. That feeling could be low mood. That feeling could be, I don't feel good about this. You want to withdraw. You know, where there's a feeling, there's a thought. And where there's a thought, there's a need. So what is it that I need right now? And that need, maybe I just need to speak to somebody and tell them, ask them the questions that I want to ask for some direction. That need, maybe I just need to go to have a toilet break, get a glass of water, calm my nerves down. Grounding yourself in situations where anxiety is at its highest is really important. Grounding does not take a 10-minute meditation session. I mean, if you can do that prior to coming in on the way into your shift, fantastic. There's lots of amazing apps that you can listen to. But grounding means that situation where you're feeling heightened emotions, those moments where you feel, I can't cope with what's going on, is scale back. Obviously, if you're doing something that's life-threatening, or, you know, don't in those instances, take a deep breath, work through it. But, you know, scale back and focus on your five senses. Like, you know, what can I see right now? What can I hear? What's going on around me? What can I touch? You know, am I touching a bandage? You know, am I sitting down? Am I touching the phone? You know, focus on the taste. I mean, we're wearing masks, so I'm sure if you've drank coffee, you can definitely say, you know, you can taste it from your mouth. It could be, you know, it could be coffee, it could be what we had for lunch. And also focusing on the sense of smell. What can I smell? You know, it really, when we focus on the five senses, it distracts our thoughts from whatever nerves we've got going on, negative thoughts, and it gets us grounded and present with the current moment. Naturally, we can't always achieve it in the first time round, but it's an exercise that can take no more than 1 to 2 minutes. It's an easy exercise to do.
I love that. I'll definitely try that next time for sure. So definitely practice it before you need it. Is that what you're kind of saying?
Definitely practice it before you need it, yes. And like I said, it doesn't need to be in the form of a half an hour yoga or meditation exercise. It's something you can do on your way on the train on your way in, or you can do it, you know, even when you're sitting down watching TV at night.
So great. Excellent. Thank you so much for that. Great tips. The only other little tip that came in my mind that I just wanted to bring up was I always bring food as well to my first shift because I don't know where things are. And I always have food like in my pockets and stuff because I just don't know what's going to happen during the shift. You know, it might be, you know, some people as well, when they're like regularly going to a workplace, they wait for the team leader to come up to them and say, hey, do you want to go on your 15-minute tea break? But when you're an agency, you kind of do need to use your initiative a little bit and bring up, you know, use your voice. And, you know, if it's hitting 10, 11 o'clock and you still haven't had a tea break yet, and you know that there's been windows within your time management plan that you could have had a break, that's when you should voice up and be like, hey, to your buddy nurse, to your team leader, hey, I've gotten all my tasks done. I do have a small window that I'm free. Is it okay if I go and have my tea break? Because this is important for your mental health as well, because you deserve a break. And if you know, but it is our responsibility to have that voice as well and say, you know, this is my time management. I do have a gap. I'm going to go step outside or step in the tea room and have a tea. And then I'll come back in 10 or 15 minutes. But if you are slammed, say there's an emergency that happens, because we're obviously healthcare workers, I always put things in my pocket like muesli bar, things like that, because if we are extremely busy and they've said to me, we're so sorry, we're trying to get your break for you, but it's just so chaotic, I understand that, and I'll just like munch on some food. So I always do that as well, because you just never know which way your shift's going to go. But I always use my voice when it comes to meals. They don't know who I am. They don't know my name. They may not know where I am to tell me to have a break. So I need to use the initiative as well to do that.
Absolutely. And that's a really good point that you raised. Obviously, the tip of having some food in your pocket, you know, like a protein bar or something, gives you that, you call it food for thought. If you're hungry, you're not going to be able to manage your thinking, you know, your thoughts as much as you'd like to. But also, more importantly, what I like, if you talk about assertiveness, if you talk about kind of, I'm worthy, I deserve to be here. Yeah. I'm not going to be a pushover and just wait for you to tell me what I'm going to do. You know, I'm going to be assertive enough in a nice way. A kind approach will always be met with usually is met with a kind response. You know, I'm just wondering, there's a bit of a gap here. Are you okay if I walk away? It doesn't have to be, I'm going on my break, I'll be back in 10 minutes. We don't want to put them off that way. Yeah. So doing it in a nice way. Is it okay? I'm going to have this lunch break and this is the opportunity. Obviously, choose the opportunity, like you said, not in the middle of a crisis or an emergency. But yeah, know your self-worth. Know that you have the skill set to be where you're at. You know that you're worthy to be where you're at. Generally, us as humans, again, we're kind of cliquey. So it's going to have to work a little bit harder if we want them to accept us. But we're not looking for them to accept us completely as best friends. We're just looking for respect. And if you keep your expectations there, then you're less likely to be disappointed.
Yeah, exactly. So good. Actually, on that topic as well, I wanted to dive into, we are very social creatures as human beings. And when you go from saying being in a full-time or part-time environment where you know who your, team leader is, you know who your colleagues are, you see the same faces all the time. But then when you go into this agency locum style world, you don't know faces, you don't know people, and you're kind of lacking that social kind of, I don't know, I guess everyone has that social aspect every day of seeing the same people all the time. But when you're an agency worker, you don't have that and you lack that. What are some kind of tips and tricks on how to overcome that when you don't have like colleagues that are your friends or like acquaintances that you actually know? How do you deal with that?
Yes, it's a good question. Obviously, we talk about managing expectations. When you go into a workplace where you're part-time, where you know people there, it's comforting, right? You kind of know who they are. You kind of know what to expect. You kind of have expectations of them, but with those expectations also comes, if I walk into work and my closest colleague is moody and says something abrupt to me, we're more likely to be hurt, right? We're more likely to take that personally. So when you go into a new workplace, we're not looking for that deep connection. So if they say something that's hurtful, if they say something that can be quite demeaning or they can reject you, not so bad, right? Because you don't have that social connection that really matters to you. You're looking at having social connections with them that at this point, let's be honest, they're going to be surface level stuff, isn't it? We're not looking for best friends. Definitely there are opportunities to make connections that go deeper, but that's not going to happen in one shift. But if you are, for example, in a country setting and you're there for a couple of weeks, you have plenty of time to form closer bonds with people. So manage your expectations. Know if you're there for one day that you're not going to walk out with the best friends, but you may walk out with some acquaintances. With the likes of social media, there's no reason why you can't connect just by engaging through likes or little comments here and there. You keep those connections, and the opportunity to build on those connections is amazing. I mean, you could have free trips across Australia. I don't have to be free, but possibly make this close enough to probably get, be able to squat at a few people's places, and you can go and experience, these towns without having to necessarily work. So it comes back to managing expectations. Know that you're going into this new setting. You want to make some bonds and social connections with people, but how meaningful they're going to be is going to depend really on how long you're there for.
Yeah, so true. And I've worked in now with Healthcare Australia, I've worked in 5 states. I just haven't done the territories yet. I know I've just got to do NT and ACT, and then I have ticked off everything. So it's been incredible. So I'm very used to having to, I guess, start those social kind of cues. I don't even know what the word is. Like, I'm just going to have to start, making friends from the very beginning. And like, as soon as I walk into that facility, I'm like, okay, I don't know anybody. But by the end of my 4-week placement or 6-week placement, I've walked out and I've made so many amazing connections. And I just think, wow, like if I never came here, or if I never put myself out of my comfort zone and did this, I would have never made this connection. So it's another part of the whole professional and personal growth, because professionally you're meeting all these amazing people that inspire you and teach you and you're learning, but then also personally you're making these amazing, incredible friendships, or you're meeting a mentor that you're just super inspired by, or new reference as well for like down the line. If you want to apply for a new position, you can be like, oh, I had a really great reference. I met, got along with the num at this facility. So yeah, it just opens up so many doors, I feel, socially. Like I know there's, a small part of it can be negative because you can walk in and you don't know anybody, but you can turn that negative into a positive very quickly.
Yes, you definitely can. You definitely can. And again, be realistic. If you walk into a ward and everyone's moody and everyone's grumpy and no one's far of you, well, can't get everyone's approval. So generally speaking, we do seek people's approval, and we let down when we don't get it. So just be mindful. Don't personalize everything that comes your way. One thing that's really interesting that you said is that you've worked in 5 different states and cities. And so you've got connections. And if you ever wanted to go, you can reach out to them. The most valuable lessons in life and the most valuable and personal growth you'll ever obtain in life is through traveling and meeting other people. not what we get day to day working in our jobs. It's not what we get through going to school or getting, tertiary degrees. It's travel that allows us to develop and have, sustain major personal growth. So you're in an opportunity where you can do that. Again, it's not all going to be positive. It's not all going to be bells and whistles. It's going to be challenging, but it would definitely be worth a challenge.
So good. Hopefully people are listening to this and they're like, oh my God, I'm so inspired. I'm going to do it now.
Oh, look, on a personal note, Jess, I lived overseas for 9 years and across the world. And for me, it was okay, I'm showing my age, but Facebook didn't come in till a bit later. I had to work tirelessly to maintain my contacts here in Australia. I had to work and then with social media, I'm still connected. So I can go to Europe, to the States, I can go anywhere for free on the day. But not just that, with some amazing people where we share such beautiful memories. And then coming back to Australia, I've still got friendships that have been around since my high school years, but I had to work at them. So remember, if you want to have a social connection with somebody, if it's a friendship that's worth having, it doesn't happen. It can happen organically, but it needs work. The connection is not a choice. The connection just happens, but making it work and the longevity of it is a choice.
Yeah, absolutely. I was just having a think just then about all, the people I've connected with over the years. And I always joke because I've been to a HCA wedding recently. I met her she's a Healthcare Australia nurse as well here in Brisbane. And I was at her wedding and I was at another hen's night. I was at another wedding of another nurse that I met while I was agency and she was a permanent staff member. I was just recently at her wedding and I've just got agency friends everywhere. I'm actually going to Hamilton Island in a few weeks with a friend, and she actually, I met her husband who was a paramedic. So he was a paramedic that came into ED and I was working in ED. We became friends. He invited me to his place for drinks to meet other people. And then I've made best friends with his wife and then her friends. And we've stayed connected for years and we see each other every couple of months. So I've just thought about it. I was like, it's not even just nursing colleagues, it's actually friends of friends. And I've grown these huge, incredible friendship groups everywhere in every state, which is, I just had a big think just then and I was like, wow, actually, I've met a lot of amazing people, haven't I?
And you've got to make a lot of money to go to all those weddings, just saying.
Yeah, I know. I've got to buy all these gifts. I've got to keep doing some agency shifts to buy the gifts.
If they start making you godmother, you're done because you signed up for a lifetime of spending on these children. But no, I think it's a beautiful way to look at it. We also have a lot of staff who are international. So, I know for me, when I was living overseas, first thing I did was buy dogs so I could connect with people at the park because I knew there was no other way I was going to make friends. But with these international staff that work for HCA, it also enables them to make informed bonds here. Meaning and purpose comes from having social connectedness. Social connectedness gives us a meaning and purpose for living and increases our overall emotional well-being. So it is vital to maintain social connectedness.
That's so great. We actually host with Healthcare Australia. We try to host quiz nights for our international staff, so they all kind of come together. And I've actually been to about a handful myself, just so I can meet everybody. And they've all been to Australia for 1 to 2 weeks. Some of them have been there for about a month, and they all come together to this quiz night. They don't know anybody. They've literally all come by themselves. They don't know anybody. And by the end of that quiz night, everyone is so close, and then we all follow each other on social media. And then I see them skydiving together the next week. And then I see another group of them in Bali together. And then another one are going on a contract in Alice Springs together. And they make friends so quickly because we try to make these networking events for our internationals as well. And we've got Facebook groups where we connect them as well. They just get very well looked after as soon as they come to Australia. They're so nervous, but we try so hard to have these events to kind of get them all connected together. And it's so awesome to see.
Oh, it's such a great initiative. So happy to hear.
Yeah. And we definitely on social media as well, even myself, if anyone wants to reach out to me on Instagram or Facebook, I already have a lot of people. And that's why I wanted to speak with you today, because I have them messaging me saying, hey, I've got my first shift in 2 days. I'm so terrified. I'm so nervous. Can you give me some feedback of what I should do and how to calm myself down? And, I'll send them voice messages. I'll call them. I'll message them. It's always the same advice that I give, but that's why I thought this episode would be so good, because it's such a common conversation I have with people on a weekly basis, I feel, whether it's friends of mine that are doing agency or brand new people, or they've just found me on social media. So it's something that goes through our minds constantly. And it's just that fear of what if people don't like me? Or what if I'm, what if I'm really bad at my job? And I'm like, you're not a bad nurse. You're not going to be bad at your job because you're in a new facility.
Yeah, no, of course not. And if you make a mistake, own it and say, oh, sorry, could you guide me? Obviously, it's not a major mistake. But also remember that, a little bit of anxiety is actually quite, what's the word I'm looking for? Quite humbling, right? When we're a bit concerned about whether we've got the skill set to do it, we're more likely to go learn more. We're more likely to do our research and upskill ourselves and get us, and get us equipped for whatever it is we need to do. I myself, I'm actually naturally an introvert and very shy. So I have lots of instances, particularly when I meet new clients in private practice, where I feel like I need to work beyond this shyness, and I don't need to reveal to them that I'm a bit anxious here and I need to get through this interview. So it's completely natural, and it helps me just grow, and it gives me, and I focus a lot on my strengths. That's my weakness, but I focus on my strengths. My other strengths could be I relate well to others. I know how to, when someone's listening, how to do active listening and how to feed back to them and how to make them feel good about themselves. Focus on your strengths rather than we've all got weaknesses. We've all got flaws. But we've also got a great deal of strength that we can draw on in these situations, in any situation, really.
Absolutely. That's so true. Well, this has been such a great episode. Like, I already feel fired up to go into my next shift. Like, I'm ready. I want to go to a new facility right now.
That's great. I'm so happy to hear.
No, honestly, you gave really incredible tips. You spoke so well as well. Like, you can definitely tell that you know what you're talking about, and you can tell you're an absolute professional in what you do. So thank you so much for giving us your time today, and all your knowledge, because these skills are going to be extremely useful for healthcare workers, and even not healthcare workers, just anyone going into new environments, I think, can benefit from this episode.
Oh, absolutely. It's an absolute pleasure, and thank you so much for giving me the opportunity.
Thank you so much. And if anyone has any questions for Sam, you can message me on Instagram, and I can forward them on as well. But thank you so much again for the health of it. And if you have time, jump online and do a quick review. We would so appreciate it on Spotify, YouTube, or Apple Podcasts. So thanks again.
Thanks, Jess.
Bye.
Bye.